Thank you for joining me today, Sonia. How are you?
I'm doing very well, Mary. Thank you for having me.
So tell me a little bit about yourself. What do you do?
Well, I'm an intensive care nurse. I've been working in intensive care for about 7 years now, and I'm currently doing my master's in critical care, and I'm in my first semester.
Oh, awesome.
Yeah.
So would you say that communication is really important being in intensive care?
Communication is very important being in intensive care. Fast-paced environment, things can go wrong quite quickly, so you need to communicate that you're seeing something going wrong, and you've got to communicate with the whole team. And then also you have to communicate with the family members, with the patients, with other disciplines that come in, and with other doctors too.
Yeah, okay. So you said that you communicate with the patients. Now, in intensive care, are most of your patients intubated?
Yes, most of our patients are intubated, and so we do a lot of nonverbal communication, especially when we're about to do any type of cares or anything like that. We always talk to the patient. We always let them know what's going on, even if they are sedated. And if we touch them, we let them know we're touching them. Yeah, and so you really need to have that nonverbal touch communication with your patients.
And so what are some good forms of communication in intensive care?
Good forms of communication are open, honest communication. And depending on your family members, in touch is very big, very important in intensive care, because a lot of times they're getting information or news that scares them, or something that they're just have never heard of. And just a simple touch, a rub on the arm, anything like that helps ease their anxiety about their loved one being in intensive care.
And especially intensive care, but with all the machines and stuff, it can be quite daunting, can't it?
It can be very scary, because a lot of these machines that they've never seen before. And just explaining to the family members what the machines actually are and what the numbers mean, so when they are sitting at the bed space and an alarm does go off, they're able to look at it and go, oh, that's a blood pressure. So they can ask us, what does that mean? What does the blood pressure mean? What's going on?
Yeah. Cool. So what are some forms of bad communication?
Well, forms of bad communication could be when a nurse goes into a bed space when there's family visiting their patient, their loved ones, and the nurse goes into the bed space and doesn't explain what they're doing. They just go in and they start doing cares, or they start doing something, and the family member doesn't know what's going on, and they can get quite scared and ignoring family members when you're doing cares and stuff, and not explaining to them exactly what you're doing, and not even telling their loved one what you're doing. And that really gets them frightened. And then not answering their questions when they have a question about something that's going on, and you brush them off because you're busy or you have to do something, and that could be a very bad form of communication in ICU.
And would you say that another form of bad communication with family members is speaking in technical terms and not talking in layman, so families do understand, and so they aren't feeling left out?
Exactly, because a lot, like I said earlier, a lot of family members don't have exposure to medical terms. And being able to know how to speak to the family, how to relay messages, and how to relay what the doctor has said, and bringing everything back down to layman's terms. And quite often a doctor will go in there and they won't use layman terms. So when the doctor leaves, the family members will ask you questions because they just don't understand the language. So it's being able to put it in a language that they understand, and putting it in a way that doesn't frighten them.
And have you seen bad forms of communication between staff members?
Actually, quite often there is bad forms of communication, because they're busy, or the person, the nurses, the coworkers, it may not be a cohesive team that day because of different personalities. And just the messages that are conveyed aren't conveyed very well, because we can either be very busy and if somebody's not paying attention to what's going on around the ward, and somebody can get a bit snippy because they don't foresee, something that they should be doing.
Yeah. Okay. So overall communication is one of the main things for the safety of the patients, and
it's for everything in intensive care. It's for the safety of the patients. It's to build a cohesive team so your team members know that you can communicate with each other. You're communicating with doctors. You have to communicate with the doctors if you have a deteriorating patient, or if there's something that you feel is just not quite right, and being able to go to the doctor and saying, I don't think this feels right, and being comfortable with that kind of communication. Or there's times where you have to use assertive communication because your patient can be deteriorating. You can be in the unit can be quite busy, and you need to get somebody's attention quite quickly. And when everybody's going a million miles an hour, you've got to be able to be quite assertive and say, listen, I need you now.
Yeah. Okay. Well, thank you for being here today. I really appreciate that. And thank you for all this information. It's been a big eye-opening.
You're welcome anytime. Thank you for having me.